We have a crisis on our hands, living in our very own community. If we put this on an international stage, we have 4,000 to 6,000 people on any given night sleeping on the streets of Portland. And if this were in another country, they might all be in a camp served by the UN and on CNN every night. Hi, Portland Street Medicine. A couple of doctors out checking on folks. Anybody home? Instead, they're our neighbors. They're sleeping under our bridges and around our corners and in our doorways. And there's a tremendous degree of suffering, and there's an opportunity to step up and help.
No matter how many clinics you build, no matter how many hospitals you build, there's a portion of the homeless population that will not come indoor and access health care.
The reality is that there are no easy solutions here, and it's going to take a community-wide effort of us all pulling together. Portland Street Medicine is one piece to that. We're offering the health care, we're offering the direct outreach, we're building trust and continuity with a fragile and complicated population, with a goal of trying to build pathways towards integrated care, towards getting into clinics, towards housing.
So the nature of this work is very simple, and the goal that we have is achievable. Making house calls is not a new practice. It's been around forever. We're just doing it a little differently. It suits this population for sure.
I think what's really surprised me about working in the camps with the homeless population is how incredibly vibrant and caring and sensitive these communities are. They are neighbors just like you and I have at our homes. And getting to know the people, getting to understand the communities, having them refer each other to our care when they'll say, gosh, I'm fine, but I'm worried about the guy 2 tents down, is really puts a very human face on the problem. People have been so warm and so welcoming on the streets. I can't begin to tell you how amazing it is to walk into a camp and from afar have people saying, hey, it's our street medicine team, they're back.
It makes me feel great because we've needed that for a long time. You guys are wonderful.
Hello again, I'm Jason Renaud, the coordinator of the Oregon Housing Conference, and now I'm with Drew Grabham, who's the leader of the Portland Street Medicine, a very exciting new outreach service. Drew, welcome.
Thank you very much.
Drew, tell me a little bit about how you got to this work, how you got to Portland Street Medicine.
Yeah, my journey began in Alaska in 1997, where I started working for a mental health center, and I quickly was allowed to go and walk around town and try to connect with people and get them engaged in services. And I sort of got the itch there and learned about it. And I moved to Portland in 2008 and started working at a local hospital in the ER and inpatient world. But I always had that itch to want to get back on the streets because that's where I really felt that healing and recovery happened. So I was fortunate enough in 2010 to get the opportunity to start doing some outreach as a paid job through OHSU here in Portland, Oregon. And I was able to start doing that work for about 8 or 9 years until I sat next to 2 doctors in a health and housing meeting that the county was running who were really interested in doing some outreach. And so I just said, like, I'll show you around. Let me take you around to do this. Cause I was kind of sick and tired. When I was by myself, my job would be to go find people and then try to bring them to services. And I realized, this would be a lot easier if I just brought the services to them. Right. Why can't I get a doctor to come out and just check out this wound? Why do they have to go through this whole hassle? I have the car. I'm the one with the privilege that can get there faster. So again, fortunately enough, 3 years ago, I was in the right place at the right time and met 2 doctors who were interested in doing this work. And 3 years ago, 2 docs, a nurse and a social worker, got in a Subaru in Portland, Oregon, and just said, like, let's just go start delivering care on the streets here. And we've been fortunate enough to be able to grow that practice of all volunteer teams to go out and serve about 1,600 unique individuals last year is what we served here in Portland on the streets.
Those sound like really unique individuals. What draws them to this sort of work? Most doctors would not even be at that county meeting, much less go out with you in a Subaru.
Yeah, what really brought them there, and I think they would share this too, is it was a part of their own wellness. It was a part of their journey where they were recognizing they were working in a system that had a lot of barriers, and they both were 2 ER physicians that were recognized that they didn't quite understand, why did people keep coming back to the ER? Why were there individuals that had high utilization that came there? And they were interested in doing that because they They wanted to feel like they were making a difference in people's lives. And that's the beautiful thing about what Portland Street Medicine does, is it provides wonderfully exceptional care for the individuals on the streets that we get to serve, but we intentionally created it so it helps address our own wellness as providers, and our own emotional distress. We often are the face of a broken system, telling somebody why we have to ration care, or why we may not be able to resolve all the issues, or be able to solve all of the problems that they present to us. And that can hurt us as human beings. Again, I know I got into this field to want to be a human-based helper for somebody. And I really wanted to get into a field where I could help empower people to be able to lift themselves up, to be able to get the resources that they need, and to work on the goals that they wanted to work on. And that's oftentimes what our traditional healthcare system doesn't allow us to practice like that. It has rules and conditions and time limits, so to speak, on what we can do with things. So street medicine really is created to help both the provider and the recipient of the services towards leading healthier, holistic lives.
So this is a movement growing all over the country. We've seen medical mobile services of many types and configurations start. Tell us a little bit about what medical mobile services are from your perspective.
Yeah, I think that's it. You're right. There are so many different models: paid staff, volunteer. Is it staffed by an EMT or an MD? And is it groups of teams and so forth? For Portland Street Medicine, how we organize our teams is a prescriber. So that could be an MD, that could be a nurse practitioner, that could be a PA, a nurse, a social service provider, which tends to be either LCSW. We have some wonderful community health workers, and a couple other like super caring resource specialists that know everything about all the services we would need to do, that go out in our teams, and we can really provide beautiful multidisciplinary care, like right in that moment. Like I will sometimes be holding somebody's foot while the doctor and the nurse are doing the wound care, while I'm talking with them about how to apply for disability benefits or things like that. And it's really this holistic picture of a whole human's life, where you get to see the conditions they're living in. And then we get to sort of practice all of our specialty cares. And it really has this powerful impact on individuals that are currently living on the streets of Portland. We often get, part of the healing that we're trying to also do, I would say, is we often just say, hey, Portland Street Medicine, you guys need anything? You're doing okay? And we so many times get, no, I'm really good, but thank you for coming out, or thank you for doing this, and just thank you for seeing me. And I say, like, the least thing we can do is see someone and hear what they say and validate that, like, it's tough or that it doesn't seem fair. If we can just see, hear, and validate, we're already practicing medicine. We're already helping folks overcome the trauma of being houseless in Portland, or houseless in the community that they live in.
I'm interested, I'm a mental health advocate and addiction advocate, but I'm always interested that that's not the first thing to talk about. That you're talking about their body, and that's a great doorway to then talk about their brain.
Right. And their feelings and their story and their history. And sometimes we get to flip it. They just tell us that. And it takes us we'll visit for a few times. They'll tell us a little bit about themselves. Then they'll say, hey, you want to check this thing out? And we're like, yes, we do. Please let us look at that. Right. We love to do that. But we really look at someone as a whole person in their living environment. So we know if somebody maybe is diabetic, on insulin, and storing their insulin in 95-degree heat out there, and we know, then we have a better understanding of some of the challenges they have and why they might come back into the hospital. Or just like when you're visiting and you're sitting in a camp with somebody, you'll see how they might care for themselves if they don't have clean water, or where they might go to the bathroom, anything like that. You can start to understand how that skin, the skin condition they have, or the abscess, isn't going to heal in that environment. So we give them the best chance that we can, and the supplies that they need to hopefully overcome that. And part of what we're trying to do is also educate our existing health system to be able to understand really what it's like to be on the streets. One of the things I'm very proud of with street medicine, again, is we bring along our county commissioners, and other decision makers, we want to show them, can I please come with us? We want to show you how some of Portlanders are living and just recognize some of the challenges they have. And then we let them speak for themselves about why they've tried to, or how they've tried to access care and haven't been able to. And what I can say it all along, all along what the stories I hear, but to hear it straight from somebody who said, like, I went to the ER and I tried to do the follow-up and I couldn't get into that clinic, they said, or I had the wrong insurance, or I didn't have a phone. You really start to see the impact of this lack of resource that these patients have and why their engagement isn't, why there's even more greater barriers to engaging just in basic care for themselves.
We're today we're in a crisis. And these people are having a crisis inside of that crisis. Start by telling us a little bit about how COVID affected people who were homeless that you were reaching out to. But also, let's also talk about the fact that we had an enormous amount of smoke in the air here in Portland over the summer, maybe about 12 days, really unbreathable. I think it was 4 packs a day of smoking. If you were outdoors all the time, no one was outdoors. And then we had the George Floyd protests in downtown Portland. Concentrated area, but that's also an area shared by a lot of homeless people. That's where they live.
Yeah. So with street medicine, we didn't stop doing any of the outreach throughout COVID. We adjusted a little bit. We shrunk our teams down to a manageable, safe level. But when COVID first started, we actually just spent a month just educating people about what it is and what they could do, and sort of trying to validate that it was a real thing that they needed to be thinking about and understanding. So for the last 2 weeks of March, first 2 weeks of April, our teams were really just providing education. We created handouts about what COVID is and isn't, what they could do, and talking about those resources. And then as COVID evolved with there, we spent more time providing just education and screening for potential breathing problems. And then our job was to really help someone navigate towards a system where they could get tested if they were interested in getting tested, or the treatment that they were. And then a lot of what with street medicine, we've continued to sort of be involved with our county created some COVID motel places for folks while they're waiting for that testing. And we would be able to refer some folks into that motel. And then we did some follow-up if they leave the motel, if they were negative, of trying to get people connected into ongoing services, if that's what they're interested in. Then when George Floyd was murdered and we had all of the protests in Portland, it had a significant impact on the population that we were serving. This was in a very small portion of downtown. It wasn't that wild. It was like the protests on TV made it be this big deal, but it did have this impact on folks on our streets. We took for about a month in July, we were taking care of a lot of wound care from rubber bullets and other things that our homeless population just sort of had secondarily, or they were sort of displaced by the protests and lost some of their medications. So again, in July, we were spending a lot of time doing skin care and other things with lots of welts and care there. And then beyond that, then we had the fires come on, and it was just the most unhealthy air you could imagine for a solid 2 weeks. And we were just basically delivering N95 masks and as many masks as we could, because there wasn't a lot of places for people to get respite from that air. My paid job is at a hospital. We were even struggling with talk about distress. You discharge somebody, but say like, now you have to leave, and you were sending them out into this harmful smoke. And so many people were just, so many providers were so distressed by that, and they should be. This shouldn't have been, no human should have been like, sorry, go out and breathe this air. I know we've got nothing else for you, but you need to go now. You need to leave. And so again, it just sort of like built up, the stress of all of these things really built up. And you could see that in and I'm talking about the provider distress, right? As us as a community, trying to address bigger needs with even less resource that exists. One of the things that I would say as a system we saw here in Portland is that before COVID, there was a lot of outreach. There was less outreach. There was less people just trying to serve this population with greater needs of a significant health crisis, and then being displaced with all of the sort of feelings and emotions of the protest, and then the fires. Again, it took a profound impact. The teams that I support with my paid job and at Portland Street Medicine, we spent considerable time just debriefing that so that we could show up for work the next day. Because it had a profound impact of trying to do more with even less that existed in the community, and recognizing that there was going to be some long-term health effects greatly disproportionately affecting the community that's houseless in Portland. What I think I want to say, and I'd be remiss if I didn't say, like, in the last few months, so this is now November, I'm oriented, November, with street medicine, we've had a significant loss. We've had more people pass away these past few months, and that's what I see coming. I think the cumulative toll of all of these things coming up, we've had more loss, and we've had we almost have had like 1 or 2 people a week that we know have passed on, which is a higher percentage.
And these are not COVID deaths necessarily.
These are not related to COVID deaths necessarily. These are other preventable deaths. But I think it all had this impact on their ability to engage in services. And I just want to, I say that with a heavy heart because people are dying on the streets. Whether it's directly related to COVID or not, it was COVID impacted because they had less services to access.
And tell me a little bit about, let's not go into why, but tell me a little bit about the impact of services being cut: food, shelter, medicine. What happened?
Yeah, here in Portland, folks, we pivoted towards virtual visits, which is a wonderful part. Like, I like that we were able to create some new opportunities there, but one of the things you need for a virtual visit is a phone. And it has to be charged. And so that became a big challenge for our folks of, like, maybe we could get them a phone, but how would they keep it charged? Our day centers weren't open for them to be able to charge. So it became more complicated. It was a pretty significant pivot to navigate those systems there. Clinics are just now in November sort of returning to having some in-person visits, but even our urgent cares are, for street medicine, one of our two of our main like referral sources, like, hey, you could stop in here, are still not doing walk-ins anymore. It's all appointment based. When we know with this population that's not really serving them well. Folks had a harder time figuring out just basic things like, where am I going to eat? Where am I going to get clean water? Where am I going to go to the bathroom? How am I going to manage the refuse that's been created? And how do we sort of do that? And then folks were, when they're displaced now, it has an even greater impact on their health because they've been able to sort of cohort up, just like all of us have pods. Hey, we'll all try to distance a little bit. We sort of have these norms. And then when that gets disrupted, people's healths are impacted and they have to start all over again. Just having this other continuing compounding effect on their lives and on their health in that moment.
Well, chat about that a little bit. Tell me about the sweeps and what has been the effect of the sweeps in Portland. Portland didn't do any sweeps for several months and is now back full-time sweeping.
Yeah, I'd say that the population that we serve, that just gets to be a really big challenge of, like, can we locate them? People are back to kind of being worried about that, or being moved along. So they have a little bit less of a priority, and like, hey, let's get you that appointment in 7 days. Remember, we got to make the phone call to get you the appointment to be able to, get your medication refilled. That's so far in the future. They're just literally trying to figure out, like, where am I going to go to the bathroom now? Or how am I going to sort of survive in this moment? And I think that sort of greatly impacted our ability to sort of help folks engage in some of the care there. And it kind of compounds that trauma. Again, I think the thing I know about all the populations we're serving is this is a very traumatized population, like, just repeatedly on a daily basis, they're being traumatized, which we know just leads towards poor health outcomes and poor health engagement at times, which just, again, has like this compounding elevated effect on their lives that I think is why we're seeing, folks passing away earlier if they're living on the streets. 20 years, if you live chronically homeless, your life expectancy is like 47, much younger than everyone else. And I think we're going to continue to see that being ramped up with COVID through this year. And doing so, and then they have this complicated grief. I just want to also say that. So the communities that have lost loved ones, they have a complicated grief process. We all do with COVID. This is hard times for everyone. This, especially with this population where they maybe can't honor that human being, or they can't connect with the other communities as they did before to honor them and have that grief. I think that's going to have a profound impact on people's sort of mental health symptoms for years to come here, of like this sort of distrust and this understanding of not being able to have closure because they're just busy trying to survive. And I think I don't know if we're prepared to like help adjust that need. Because again, I think that work is best done out directly face to face, not on a phone or not on a screen. I don't know how you could do that. And I think that's something we need to be really thinking about. How can we engage this population in some of that grief work that they're going to need to have?
Yeah, and we need a pastoral version, Portland Street Past. Let me ask you though, you mentioned long-term, it doesn't look like, it looks like the bourgeoisie might get access to the vaccine fairly soon, within the next 6 months. But the population that you see, do you think that they're probably in for another year or so?
Like it could be, it'll be really interesting to see how do we continue to ration that healthcare and how do we get them access to it, recognizing that they're a pretty vulnerable population as well. So I've not been in any of the specific conversations about how we sort of help connect this population, but I would say that we know that the population we're serving is very ill usually by the time that we start to engage with them, and have an even greater risk of having complications from COVID, or if not succumbing to COVID when they're there.
So sad, so sad. Thank you for your work, Drew.
Mm-hmm.
Thank you for your work, and thank you for presenting this session.
Yeah.
Any final words?
Yeah. I think let me think. What did I really want to say? I think the interesting thing that I think about with street medicine and all this is like, it's just a super great honor for us to be able to go out and meet this population and to really connect with them. And I just really encourage folks to just think more about how we can be creative. COVID has created some cool opportunities. We have been able to start like doing a buprenorphine virtual visits with some folks, and that's a wonderful thing. So what are some of the positives we can take from COVID, and some of the collaborations that we can take from there, and make sure that we continue to have those things moving on into the future? Just like we've also recognized that, like, if we didn't understand it before, housing is healthcare, and people's lack of housing does have a more profound impact on their healthcare. And I hope that we can continue to advocate for that and understand and truly see those in these times. These are very challenging times for individuals, and yet some of the most resilient people are the people that I get to care for and get to know and be a part of my community that are sleeping on the streets. They're wonderfully gifted individuals who often have so much more resilience than I have as a housed individual. And it's just a wonderful thing to see. And yet it's even harder when you see the profound suffering that they have. And that's that distress that I have. And that's ultimately what led me to spend my days off doing what I was paid to do as well, because it was just a part of who I am, to want to be a part of some kind of solution. And that's what street medicine taught me, is that, like, even when it felt like it's overwhelming to change the system, well, I'm going to just start one life at a time, one step at a time. And hey, here we are. And I feel like we've made some great progress here, and I'm really honored to get to do that work. Every time I am in a street medicine meeting, I'm so thankful to be in that community. And every time I'm on the street, everyone has the biggest smile, because it is just really lovely, hard work. We have a dedicated crew that's just quite amazing. So if you haven't done outreach, please think about doing it. Reach out, try it. I guarantee it will touch part of your soul that will actually lead towards healing for yourself. So I think that's a good way. That's a good way for me to think about it. But I just encourage people to think outside the box. If COVID, we can do it. And when we do it, it does profoundly change you in this beautiful way as well.
Thank you, Drew. It is a spiritual journey.